The nurse is performing an assessment on a pregnant client in the last trimester with a diagnosis of severe preeclampsia. The nurse reviews the assessment findings and determines that which finding is most closely associated with a complication of this diagnosis. 1. Enlargement of the breasts. 2. Complaints of feeling hot when the room is cool. 3. Periods of fetal movement followed by quiet periods. 4. Evidence of bleeding, such as in the gums, petechia, and purpura. Answer. 4. Evidence of bleeding, such as in the gums, petechia, and purpura. Rationale. Severe preeclampsia can trigger disseminated intravascular coagulation (DIC) because of the widespread damage to vascular integrity. Bleeding is an early sign of DIC and should be reported to the primary healthcare provider if noted on assessment. Options 1, 2, and 3 are normal occurrences in the last trimester of pregnancy. The nurse is reviewing the primary healthcare provider's PHCP's prescriptions for a client admitted for premature rupture of the membranes. Gestational age of the fetus is determined to be 37 weeks. Which prescription should the nurse question? 1. Monitor fetal heart rate continuously. 2. Monitor maternal vital signs frequently. 3. Perform a vaginal examination every shift. 4. Administer an antibiotic per prescription and per agency protocol. Answer. 3. Perform a vaginal examination every shift. Rationale. Vaginal examinations should not be done routinely on a client with premature rupture of the membranes because of the risk of infection. The nurse would expect to monitor fetal heart rate, monitor maternal vital signs, and administer an antibiotic. The nurse evaluates the ability of a hepatitis B positive mother to provide safe bottle feeding to her newborn during postpartum hospitalization. Which maternal action best exemplifies the mother's knowledge of potential disease transmission to the newborn? 1. The mother requests that the window be closed before feeding. 2. The mother holds the newborn properly during feeding and burping. 3. The mother tests the temperature of the formula before initiating feeding. 4. The mother washes and dries her hands before and after self-care of her perineum and asks for a pair of gloves before feeding. Answer. 4. The mother washes and dries her hands before and after self-care of her perineum and asks for a pair of gloves before feeding. Rationale. Hepatitis B virus is highly contagious and is transmitted by direct contact with blood and body fluids of infected persons. The rationale for identifying childbearing clients with this disease is to provide adequate protection of the fetus and the newborn, to minimize transmission to other individuals, and to reduce maternal complications. The correct option provides the best evaluation of maternal understanding of disease transmission. Option 1 will not affect disease transmission since hepatitis B does not spread through airborne transmission. Options 2 and 3 are appropriate feeding techniques for bottle feeding, but do not minimize disease transmission for hepatitis B. The charge nurse on a labor and delivery unit has numerous admissions and must transfer one of the clients to the postpartum gynecological unit, where the nurse-to-client ratio will be 1:4. Which antepartum client is the most appropriate one to transfer? 1. The 36-year-old gravidae para 0 client who is at 24 weeks gestation and is being monitored for preterm labor. 2. The 26-year-old gravidae para 0 client who is at 10 weeks gestation and is experiencing vaginal bleeding. 3. The 40-year-old gravida 3 para 0 client who is at 38 weeks gestation and is complaining of decreased fetal movement. 4. The 29-year-old gravida I para 0 client who is at 42 weeks gestation and had a biophysical profile score of 5 earlier today. Answer. 2. The 26-year-old gravidipara-0 client who is at 10 weeks gestation and is experiencing vaginal bleeding. Rationale. The fetus of the client at 10 weeks gestation is in a previability stage, whereas those of the other clients are at a stage of viability. There is limited monitoring that can be done with a 10-week fetus. Doppler monitoring is not feasible during the first trimester. Bed rest and continued monitoring are most likely the primary treatments for this client at this point in her pregnancy. Bed rest could be maintained, and bleeding could be monitored by a postpartum nurse. The clients with preterm and postterm gestations 24 and 42 weeks respectively are those most at risk, so these clients require more fetal monitoring. The woman who is at 38 weeks gestation is also in need of fetal monitoring because of a possibility of decreased fetal movement. Until the fetal well-being can be confirmed with fetal monitoring, this client should remain on the labor and delivery unit where she can be continuously monitored. In addition, the two older clients, 36 and 40 years, are considered to be of advanced maternal age, indicating a need for closer monitoring. The nurse is assessing a client who is 6 hours postpartum after delivering a full-term healthy newborn. The client complains to the nurse of feelings of faintness and dizziness. Which nursing action is most appropriate? 1. Raise the head of the client's bed. 2. Obtain hemoglobin and hematocrit levels. 3. Instruct the client to request help when getting out of bed. 4. Inform the nursery room nurse to avoid bringing the newborn to the client until the client's symptoms have subsided. Answer 3. Instruct the client to request help when getting out of bed. Rationale. Orthostatic hypotension may be evident during the first 8 hours after birth. Feelings of faintness or dizziness are signs that caution the nurse to focus interventions on the client's safety. The nurse should advise the client to get help the first few times she gets out of bed. Option 1 is not a helpful action in this situation and would not relieve the symptoms. Option 2 requires a primary healthcare provider's prescription. Option 4 is unnecessary. The nurse is reviewing the results of the rubella screening titer with a pregnant client. The test results are positive, and the mother asks if it is safe for her toddler to receive the vaccine. What is the nurse's best response? 1. Most children do not receive the vaccine until they are 5 years of age. 2. You are still susceptible to rubella, so your toddler should receive the vaccine. 3. It is not advised for children of pregnant women to be vaccinated during their mother's pregnancy. 4. Your titer supports your immunity to rubella, and it is safe for your toddler to receive the vaccine at this time. Answer 4. Your titer supports your immunity to rubella, and it is safe for your toddler to receive the vaccine at this time. Rationale. All pregnant women should be screened for prior rubella exposure during pregnancy. A positive maternal titer further indicates that a significant antibody titer has developed in response to a prior exposure to rubella. All children of pregnant women should receive their immunizations according to schedule. In addition, no definitive evidence suggests that the rubella vaccine virus is transmitted from client to client. The home care nurse visits a client who has delivered a healthy newborn infant via vaginal delivery. An episiotomy was performed, and the woman has developed a wound infection at the episiotomy site. The nurse provides instructions to the client regarding care related to the infection. Which statement, if made by the mother, indicates a need for further instruction? 1. I need to take the antibiotics as prescribed. 2. I need to take warm sitz baths to promote healing. 3. I need to apply warm compresses to provide comfort. 4. I need to isolate the infant for 48 hours after beginning the antibiotics. Answer 4. I need to isolate the infant for 48 hours after beginning the antibiotics. Rationale: the infant is not isolated routinely from the mother with a wound infection, but the mother must be taught good hand-washing techniques and how to protect the infant from contact with contaminated articles. If the mother has a wound infection, broad-spectrum antibiotics will be prescribed for the mother, and she should be instructed to take the antibiotics as prescribed. Analgesics are often necessary, and sitz baths or warm compresses may be used to provide comfort in the area. There is no need to isolate the infant. A pregnant woman tests positive for the hepatitis B virus, HBV. The woman asks the nurse if she will be able to breastfeed the baby as planned after delivery. Which response by the nurse is most appropriate? 1. Breastfeeding can start 6 months after delivery. 2. Breastfeeding is allowed after the baby has been vaccinated with immune globulin. 3. Breastfeeding is not advised and you should seriously consider bottle feeding the baby. 4. Breastfeeding is not a problem and you will be able to breastfeed immediately after delivery. Answer 2. Breastfeeding is allowed after the baby has been vaccinated with immune globulin. Rationale: although HBV is transmitted in breast milk, after scheduled newborn vaccines and immune globulin have been administered to the newborn, the woman may breastfeed without risk to the newborn. The remaining options are incorrect responses. A maternity unit nurse is creating a plan of care for a client with severe preeclampsia who will be admitted to the nursing unit. The nurse should include which nursing intervention in the plan? 1. Restrict food and fluids. 2. Reduce external stimuli. 3. Monitor blood glucose levels. 4. Maintain the client in a supine position. Answer 2. Reduce external stimuli. Rationale: the client with severe preeclampsia is kept on bed rest in a quiet environment. External stimuli such as light, noise, and visitors that may precipitate a seizure should be kept to a minimum. Food and fluid are not restricted unless specifically prescribed by the primary healthcare provider. The client is instructed to rest in a left lateral position to decrease pressure on the vena cava, thereby increasing cardiac perfusion of vital organs. The nurse is caring for a pregnant woman who has herpes genitalis. The nurse provides instructions to the woman about treatment modalities that may be necessary for this condition. Which statement made by the woman indicates an understanding of these treatment measures? 1. I do not need to abstain from sexual intercourse. 2. I need to use vaginal creams after I douche every day. 3. I need to douche and perform a sitz bath 3 times a day. 4. It may be necessary to have a cesarean section for delivery. Answer 4. It may be necessary to have a cesarean section for delivery. Rationale: if a woman has an active lesion, either recurrent or primary at the time of labor, delivery should be by cesarean section. Women are advised to abstain from sexual contact while the lesions are present. If it is an initial infection, the woman should continue to abstain from sexual intercourse until the cultures are negative because prolonged viral shedding may occur. Douches are contraindicated, and the genital area should be kept clean and dry to promote healing. An infant is born to a mother with hepatitis B. Which prophylactic measure is indicated for the infant? 1. Hepatitis B vaccine given within 24 hours after birth. 2. Immune globulin (IG) given as soon as possible after delivery. 3. Hepatitis B immune globulin (HBIG) given within 14 days after birth. 4. Hepatitis B immune globulin (HBIG) and hepatitis B vaccine given within 12 hours after birth. Answer 4. Hepatitis B immune globulin (HBIG) and hepatitis B vaccine given within 12 hours after birth. Rationale. Both HBIG and the vaccine are given to infants with perinatal exposure to prevent hepatitis and achieve lifelong prophylaxis. They are administered within 12 hours after birth. IG is given to prevent hepatitis A. Which statement reflects a new mother's understanding of the teaching about the prevention of newborn abduction? 1. I will place my baby's crib close to the door. 2. Some healthcare personnel won't have name badges. 3. I will ask the nurse to attend to my infant if I am napping and my husband is not here. 4. It's okay to allow the nurse assistant to carry my newborn to the nursery. Answer 3. I will ask the nurse to attend to my infant if I am napping and my husband is not here. Rationale. Precautions to prevent infant abduction include placing a newborn's crib away from the door, transporting a newborn only in the crib and never carrying the newborn. Expecting healthcare personnel to wear identification that is easily visible at all times. And asking the nurse to attend to the newborn if the mother is napping and no family member is available to watch the newborn. The newborn is never left unattended. If the mother states that she will ask the nurse to watch the newborn while she is sleeping, she has understood the teaching. Options 1, 2, and 4 are incorrect and indicate that the mother needs further teaching. Which one of the following newborn reflexes should the nurse be able to elicit at a 6-month well baby visit? A. Moro B. Babinski C. Startle D. Extrusion. Answer B. Babinski. Rationale. Babinski is normal in 6-month well baby, disappear in 2 years old. Moro appear in newborns and expects to disappear in 6 months. Extrusion disappear in 4 months of age. A Nonstress test is performed on a client who is pregnant, and the results of the test indicate non-reactive findings. The primary healthcare provider prescribes a contraction stress test, and the results are documented as negative. How should the nurse document this finding? 1. A normal test result. 2. An abnormal test result. 3. A high risk for fetal demise. 4. The need for a cesarean section. Answer 1. A normal test result. Rationale. Contraction stress test results may be interpreted as negative, normal, positive, abnormal, or equivocal. A negative test result indicates that no late decelerations occurred in the fetal heart rate, although the fetus was stressed by 3 contractions of at least 40 seconds duration in a 10-minute period. Options 2, 3, and 4 are incorrect interpretations. A pregnant client is admitted in labor. The nursing assessment reveals that the client's hemoglobin and hematocrit levels are low, indicating anemia. What should the nurse observe for following the client's labor? 1. Anxiety. 2. Hot flashes. 3. Low self-esteem. 4. Postpartum infection. Answer 4. Postpartum infection. Rationale. Anemic women have a greater likelihood of cardiac decompensation during labor, postpartum infection, and poor wound healing. Anemia does not specifically present a risk for hot flashes. Anxiety and low self-esteem are unrelated to physiological integrity. The nurse is preparing to care for a newborn with respiratory distress syndrome. Which initial action should the nurse plan to best facilitate bonding between the newborn and the parents? 1. Encourage the parents to touch their newborn. 2. Identify specific caregiving tasks that may be assumed by the parents. 3. Explain the equipment that is used and how it functions to assist the newborn. 4. Give the parents pamphlets that will help them understand their newborn's condition. Answer 1. Encourage the parents to touch their newborn. Rationale: the best initial action to begin the attachment process and promote bonding is to encourage the parents to touch their newborn. The parent's initial need is to become acquainted with their newborn. Caregiving tasks may be frightening to the parents because of the condition of the newborn and the unfamiliarity of high-risk newborn care practices. This option will be appropriate later, as the newborn's condition becomes stable. Explaining equipment is important but is not specific to parent-newborn bonding activities. Providing pamphlets is inappropriate initially. Requiring parents to focus on pamphlets or literature does not enhance the parent-newborn bond. A client in labor is dilated 10 centimeters. At this point in the labor process, at least how often should the nurse assess and document the fetal heart rate? 1. Hourly. 2. Every 15 minutes. 3. Every 30 minutes. 4. Before each contraction. Answer 2. Every 15 minutes. Rationale: the second stage of labor begins when the cervix is dilated completely 10 centimeters. Maternal pulse blood pressure and fetal heart rate are assessed every 5 to 15 minutes, depending on agency protocol. Some agency protocols recommend assessment after each contraction. Hourly and every 30 minutes represent lengthy time intervals for assessment in this stage of labor. The nurse is reviewing the record of a pregnant client seen in the healthcare clinic for the first prenatal visit. Which data, if noted on the client record, should alert the nurse that the client is at risk for a spontaneous abortion? 1. Age 35 years. 2. History of syphilis. 3. History of genital herpes. 4. History of diabetes mellitus. Answer 2. History of syphilis. Rationale: maternal infections such as syphilis, toxoplasmosis, and rubella are causes of spontaneous abortion. There is no evidence that genital herpes is a causative agent in abortion, although the presence of active lesions at the time of birth presents concerns. Maternal age greater than 40 years and diabetes mellitus are considered high risk factors in a pregnancy but are related to an increased risk of congenital malformations, not abortions. A home care nurse is monitoring a 16-year-old prima gravida who is at 36 weeks gestation and has gestational hypertension. Her blood pressure during the past 3 weeks has been averaging 130/90ths of a millimeter Hg. She has had some swelling in the lower extremities and has had mild proteinuria. Which statement by the woman should alert the nurse to the worsening of gestational hypertension? 1. My vision for the past 2 days has been really fuzzy. 2. The swelling in my hands and ankles has gone down. 3. I had heartburn yesterday after I ate some spicy foods. 4. I had a headache yesterday, but I took some acetaminophen and it went away. Answer 1. My vision for the past 2 days has been really fuzzy. Rationale: visual disturbances such as blurred vision, double vision, or spots before the eyes indicate arterial spasms and edema in the retina and may be a warning sign of worsening gestational hypertension. Resolution of swelling is not an indicator of preeclampsia. Heartburn is a common discomfort of pregnancy, especially with intake of spicy foods. A continuous headache indicates poor cerebral perfusion. Having just one headache that is relieved with medication is not an indicator of preeclampsia. The nurse is assessing a client in the 4th stage of labor and notes that the fundus is firm, but that bleeding is excessive. Which should be the initial nursing action? 1. Record the findings. 2. Massage the fundus. 3. Notify the obstetrician. 4. Place the client in Trendelenburg's position. Answer 3. Notify the obstetrician. Rationale: if bleeding is excessive, the cause may be laceration of the cervix or birth canal. Massaging the fundus if it is firm would not assist in controlling the bleeding. Trendelenburg's position should be avoided because it may interfere with cardiac and respiratory function. Although the nurse would record the findings, the initial nursing action would be to notify the OB. The nurse in a birthing room is monitoring a client with dysfunctional labor for signs of fetal or maternal compromise. Which assessment finding should alert the nurse to a compromise? 1. Maternal fatigue. 2. Coordinated uterine contractions. 3. Progressive changes in the cervix. 4. Persistent unreassuring fetal heart rate. Answer 4. Persistent unreassuring fetal heart rate. Rationale. Signs of fetal or maternal compromise include a persistent, non-reassuring fetal heart rate, fetal acidosis, and the passage of meconium. Maternal fatigue and infection can occur if the labor is prolonged but do not indicate fetal or maternal compromise. Coordinated uterine contractions and progressive changes in the cervix are a reassuring pattern in labor. The nurse in a labor room is assisting with the vaginal delivery of a newborn infant. The nurse should monitor the client closely for the risk of uterine rupture if which occurred. 1. Forceps delivery. 2. Schultz presentation. 3. Hypotonic contractions. 4. Weak bearing down efforts. Answer 1. Forceps delivery. Rationale. Excessive fundal pressure. Forceps delivery. Violent bearing down efforts. Tumultuous labor. And shoulder dystocia can place a client at risk for traumatic uterine rupture. Schultz presentation is the expulsion of the placenta with the fetal side presenting first and is not associated with uterine rupture. Hypotonic contractions and weak bearing down efforts do not add to the risk of rupture because they do not add to the stress on the uterine wall. The nurse is caring for a client in the active stage of labor. The nurse notes that the fetal pattern shows a late deceleration on the monitor strip. Based on this finding, the nurse should prepare for which appropriate nursing action. 1. Administering oxygen via face mask. 2. Placing the mother in a supine position. 3. Increasing the rate of the intravenous IV oxytocin infusion. 4. Documenting the findings and continuing to monitor the fetal patterns. Answer 1. Administering oxygen via face mask. Rationale. Late decelerations are caused by uteroplacental insufficiency as a result of decreased blood flow and oxygen to the fetus during the uterine contractions. This causes hypoxemia, therefore, oxygen is necessary. The supine position is avoided because it decreases uterine blood flow to the fetus. The client should be turned on her side to displace pressure of the gravid uterus on the inferior vena cava. An IV oxytocin infusion is discontinued when a late deceleration is noted otherwise. The oxytocin would cause further hypoxemia because of increased uteroplacental insufficiency caused by stimulation of contractions caused by the oxytocin. Documenting and monitoring would delay necessary treatment. The nurse performs an assessment on a client who is 4 hours postpartum. The nurse notes that the client has cool, clammy skin and is restless and excessively thirsty. What immediate action should the nurse take? 1. Provide oral fluids and begin fundal massage. 2. Begin hourly pad counts and reassure the client. 3. Elevate the head of the bed and assess vital signs. 4. Assess for hypovolemia and notify the primary healthcare provider, PHCP. Answer 4. Assess for hypovolemia and notify the primary healthcare provider, PHCP. Rationale. Symptoms of hypovolemia include cool, clammy, pale skin, sensations of anxiety or impending doom. restlessness, and thirst. When these symptoms are present, the nurse should further assess for hypovolemia and notify the PHCP. Providing oral fluids and beginning fundal massage and beginning hourly pad counts and reassuring the client will delay necessary treatment. Also, the question gives no indication of the cause of the hypovolemia or that the client is hemorrhaging and that fundal massage is needed. The head of the bed is not elevated in a hypovolemic condition. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication, if which findings are noted on assessment. Select all that apply. 1. Proteinuria of 3+2. Respirations of 10 breaths per minute 3. Presence of deep tendon reflexes 4. Urine output of 20 milliliters in an hour 5. Serum magnesium level of 4 MEq/L to mmol/L. Answer 2. Respirations of 10 breaths per minute 4. Urine output of 20 milliliters in an hour. Rationale: magnesium toxicity can occur from magnesium sulfate therapy. Signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication and include respiratory depression, loss of deep tendon reflexes, and a sudden decline in fetal heart rate and maternal heart rate and blood pressure. Respiratory rate below 12 breaths per minute is a sign of toxicity. Urine output should be at least 25 to 30 milliliters per hour. Proteinuria of 3+ is an expected finding in a client with preeclampsia. Presence of deep tendon reflexes is a normal and expected finding. Therapeutic serum levels of magnesium are 4 to 7.5 MEq/L, 2 to 3.75 mmol/L, which are considered normal findings in a newborn less than 12 hours old. Select all that apply. 1. Grunting respirations 2. Presence of vernix caseosa 3. Heart rate of 190 beats per minute 4. Anterior fontanelle measuring 5 cm 5. Bluish discoloration of hands and feet 6. Yellow discoloration of the sclera and body. Answer 2. Presence of vernix caseosa 4. Anterior fontanelle measuring 5 cm 5. Bluish discoloration of hands and feet. Rationale: vernix caseosa, a 5 cm anterior fontanelle, and acrocyanosis, bluish discoloration of hands and feet, are normal findings. Grunting respirations are a sign of possible respiratory distress. The normal newborn heart rate is 100 to 160 beats per minute. The presence of the yellow discoloration could indicate newborn jaundice. The nurse is performing an assessment on a client who suspects that she is pregnant and is checking the client for probable signs of pregnancy. The nurse should assess for which probable signs of pregnancy. Select all that apply. 1. Ballottement 2. Chadwick's sign 3. Uterine enlargement 4. Positive pregnancy test 5. Fetal heart rate detected by a non-electronic device 6. Outline of fetus via radiography or ultrasonography. Answer 1. Ballottement 2. Chadwick's sign 3. Uterine enlargement 4. Positive pregnancy test. Rationale: the probable signs of pregnancy include uterine enlargement, Hagar's sign, compressibility and softening of the lower uterine segment that occurs at about week 6. Goodell sign, softening of the cervix that occurs at the beginning of the 2nd month. Chadwick's sign, violet coloration of the mucous membranes of the cervix, vagina, and vulva that occurs at about week 4. Ballottement, rebounding of the fetus against the examiner's fingers on palpation, Braxton Hicks contractions, and a positive pregnancy test for the presence of human chorionic gonadotropin. Positive signs of pregnancy include fetal heart rate detected by electronic device Doppler transducer at 10 to 12 weeks and by non-electronic device fetoscope at 20 weeks of gestation. Active fetal movements palpable by the examiner and an outline of the fetus by radiography or ultrasonography. The nurse is collecting data from a pregnant client in the second trimester of pregnancy who was admitted to the maternity unit with a suspected diagnosis of abruptio placentae. Which findings are associated with abruptio placentae? Select all that apply. 1. Uterine tenderness. 2. Acute abdominal pain. 3. A hard, board-like abdomen. 4. Painless bright red vaginal bleeding. 5. Increased uterine resting tone on fetal monitoring. Answer. 1. Uterine tenderness. 2. Acute abdominal pain. 3. A hard, board-like abdomen. 5. Increased uterine resting tone on fetal monitoring. Rationale. In abruptio placentae, acute abdominal pain is present. Uterine tenderness accompanies placental abruption, especially with a central abruption and trapped blood behind the placenta. The abdomen will feel hard and board-like on palpation as the blood penetrates the myometrium and causes uterine irritability. Observation of the fetal monitoring often reveals increased uterine resting tone caused by placental abruption. Painless, bright red vaginal bleeding in the second or third trimester of pregnancy is a sign of placenta previa. The rubella vaccine has been prescribed for a new mother. Which statements should the postpartum nurse make when providing information about the vaccine to the client? Select all that apply. 1. You will need a second vaccination at your 6-week postpartum visit. 2. You need this vaccine because you are not immune to the rubella virus. 3. You should avoid sexual intercourse for 2 weeks after the administration of the vaccine. 4. You should not become pregnant for 1 to 3 months after the administration of the vaccine. 5. You should avoid heat and extreme temperature changes for a week after the administration of the vaccine. Answer. 2. You need this vaccine because you are not immune to the rubella virus. 4. You should not become pregnant for 1 to 3 months after the administration of the vaccine. Rationale. Rubella vaccine is a live attenuated virus that provides immunity for 15 years. A second vaccination is not required to attain immunity. Because rubella is a live vaccine, it will act as a virus and is potentially harmful to the organogenesis phase of fetal development. If not immune titer less than 1 to 8, then the client should be vaccinated in the postpartum period. The client should be informed about the potential effects of this vaccine and the need to avoid becoming pregnant for 1 to 3 months after its administration. Abstinence from sexual intercourse is unnecessary. Warmth and extreme changes in temperature have no effect on the client who has been vaccinated. The nurse is performing an assessment of a prima gravida who is being evaluated in a clinic during her second trimester of pregnancy. Which findings concern the nurse and indicate the need for follow-up? Select all that apply. 1. Quickening. 2. Braxton Hicks contractions. 3. Fetal heart rate of 180 beats per minute. 4. Consistent increase in fundal height. 5. Elevated level of maternal serum alpha-fetoprotein, MSAFP. Answer. 3. Fetal heart rate of 180 beats per minute. 5. Elevated level of maternal serum alpha-fetoprotein, MSAFP. Rationale. The normal range of the fetal heart rate depends on gestational age. The heart rate is usually 160 to 170 beats per minute in the first trimester and slows with fetal growth. Near and at term, the fetal heart rate ranges from 110 to 160 beats per minute. An elevated MSAFP should be followed up with more specialized testing to determine if a neural tube problem exists. The remaining options are normal expected findings.